Board of Health. And seeing we have an election coming up, I'm going to take a few minutes for people to get to know their Board of Health. I know that I've been out there, we've had a couple candidates, and people say, well, who's on the board? So I'm going to just quickly go around. I'm going to follow my lead. I'm going to give my name and basically a background and everything. So I'm Peter Yap. I'm finishing up 9 years on the Board of Health. I am not running again. It's been a good experience, I'll tell you. My background was I was a telephone engineer, and I've always farmed and lived in Littleton all my life. So I built my own home, so I know what it was like to be on both sides of the board, either coming before them or being on this side. And having said that, Bill, would you go next?
Bill Cole. I've been on the board for 2.5 years, almost 3. My business has been in town since 1978. I retired out of that construction business and started working for the town as maintenance supervisor about 6.5, 7 years ago. And my background in construction, I have a certain amount of familiarity with septic systems and so on and so forth, and I was very interested when the opening came to be on the board, and that's why I'm here.
And we're glad for it. Ann?
I'm Ann Laree. I have a Master of Science in Public Health, focus on infectious disease epidemiology. I'm a certified health officer with the state, and I'm going through some of the basic certifications to become a health agent.
Thank you, Ann.
I've been in public health for 30 years, and I got onto the board because I designed and developed with our health agent the Medical Reserve Corps.
Thank you. And we have Brad Mitchell, who's missing tonight. Brad recently got on the board, it was last year, I believe. Yeah. And he is a representative of the Massachusetts Farm Bureau and does a lot with the laws and things that affect farmers, so he's very well acquainted with Title V and some of those other issues. And last but not least, Gino.
Well, my name is Gino Ferraroning. I'm a Littleton resident. For some reason, I got drafted the first time, and I got appointed, and then I got elected a couple of times. So I've been working construction for many, many years, working the septic system. One of the major sewage treatment was made up in the North Shore, $120 million. So they figured that might be useful in the Board of Health, so here I am, trying to help people in Littleton.
And last but not least, introduce Shelley.
Shelley.
Shelley has
Speak.
been our admin now for, what, 3 years?
3 years.
3 years.
She's a very nice lady. Just
Let her
don't
speak.
step on toes.
Go ahead, Shelley, tell a little about you.
Well, I basically handle the day-to-day operations of the Board of Health office, helping residents with questions on Title V inspections and permits, and attend the meetings to handle the administrative matters.
And you have several hats you're wearing. You work for the Buildings
The
Department.
Building Department, the Zoning Board of Appeals, and the Board of Health.
Thank you, Shelley. And having said that, Shelley, we went to upgrade her, and it's been going on for several months. And we've finally come to fruition that she's being upgraded to, what is it, band 29 or something?
Grade 9.
Grade 9.
Yep.
So it's going to require the board to appoint Shelley. I would see if there's a motion to appoint Shelley.
I will make that motion.
Do I have a second?
A second.
I have a second.
Okay, I have a motion and a second to appoint Shelley as Board of Health admin. All those in favor say aye.
Aye.
So with that, I have to sign it.
Does it need to be notarized?
No, just signed by one more board.
Today is the 14th, isn't it?
Yes.
Yes.
Okay, do we have board member reports? Does anybody have anything that they'd like to report on? I know I haven't been around for 2 or 3 weeks, or whatever it was.
I have something, but if other people?
Well, Bill, you want to start your end? You all set?
Just that the problem with the cots in the trailer, there were too many cots for in the trailer at the fire department. I spoke with Scott, and they found a home at the fire department for them, so they don't have to be relocated at the police station.
How many cots do we have? Any
We have
idea?
150 now,
But the trailer
And-
just couldn't accommodate all
Right.
of them.
right.
But we don't keep any, at one time, they were keeping stuff under the stairs or something at the high school or the middle
No.
school.
No.
Nothing
Can't do
like
that.
that anymore.
It's all at the fire
Okay, thank you,
department.
Bill. Ann?
Okay, I met with the fire chief today, and we're going to be planning a spring get-together with the Medical Reserve Corps, introduce a CERT component, and also make some planning efforts towards some of our activities over the next year. And we also discussed the cots, and he did show me where they're going to be stored, so we now know they'll be at the fire station. And we all now have the blankets and the cots.
Very good. Gino?
No, at the moment, I have no.
The only thing I have, I was outside wandering around my property, making it look like I was working. And I had someone from the state stop for talking about the bees and spraying.
Yeah, yeah.
And they left this off. Basically, they're telling you if you want to be listed or you're listed in there or something for a number to call. I wonder if we shouldn't put something in the newspaper. Do you have?
Is that through Central Mass Mosquito?
This is the state. The guy that came was in a state car, and basically, he had a list of beekeepers. When he stopped, he asked if I still had bees, and it was basically they wanted to make sure that they weren't going to spray in that area. So he must be directing what do they call it? It's the Middlesex,
Yeah, Central Mass Mosquito.
Central
Yeah,
Middlesex.
that's what the seal is in the border. It is the Central Middlesex Mosquito Control Seal at the border, right?
Yeah, that is. And I think that's where they are. The guy was from the state, though. We had a state car, maybe he's borrowing it, I don't know. So I'm gonna leave this with you, maybe if we can get something in the paper. Do we have minutes?
Nope.
We do have minutes. Well, this is
No,
Jim.
that's Jim's comments.
So,
How you doing, Jeffrey?
community septic loan update. Shelley, do you have any information on that?
So the first one has gone back to RCAP for recording, and then the way that Steve explained it to me was as soon as it's recorded, then RCAP puts in to Mass Water Pollution Abatement Trust to send the money to the town, and then the town can start releasing it. So we have the invoice for that first homeowner ready to process as soon as we know that the
Just
funds are
one,
here.
that's all we have is one.
Another one came in yesterday, and so I sent back to her and told her to send the betterment agreement. That's what the board has to sign. And she said a third one she thought would be ready by the end of the week. She's been working with one other homeowner who's sent it in, but it's not, the application isn't done yet, and she hasn't got anything from the fifth one yet.
How's the fellow on, what's it, Narcissus?
Yeah, he's submitted partial applications, but
So
he
they-
hasn't submitted
so
everything
Did he
yet.
get through to that woman and talk with her?
Mm-hmm.
But basically, what we're talking about, there's a program out for people that have issues where they
Septic.
maybe don't have enough money to replace a failed system, and this is for only failed systems. And in order to get the loan to do them, they have to have three inspections, three
Estimates.
estimates, thank you. Boy, I'm doing mental blocks here tonight. So consequently, it's taken quite a lengthy time to get this underway, but hopefully we will get it going. We also have, I guess we have to nominate Phyllis Tower is our animal inspector.
Can I make a
Sure.
comment on the community septic?
Sure,
line?
go ahead.
Okay,
And-
I was speaking with Jim this week, and I know that we had already ranked out the different people that had put their names in last summer.
Yeah, that's
I
quite a
know
while ago.
19 Dahlia Drive is like one of the next to be considered, or something close. It was number 6 or number 7, I can't remember. At any rate, I went by that address several times in the past few weeks, and I think that system's in failure. So I let Jim know, and he went out to look and see. But I think that when we're ready to move on beyond the first 5, that person would be the next.
Yes, I'm point out too, I'm
consider.
glad you brought that up. I'll point out part of the approval process is ones that could be affecting like clean water, like lakes
Yeah.
and things of that nature. So that clearly would be affecting Long Lake. On the animal inspector, let's see what we have here. So we just do it same as Ann. Somebody,
Yep.
someone make a motion that we nominate Phyllis Tower as the inspector of animals.
Sure, I'll make that nomination.
Does anybody, do we have a second?
Second.
Well, I have a motion, a second, to nominate Phyllis Tower as our inspector of animals. All those in favor?
Aye.
Aye. Phyllis also fills in for dog complaints through the police department. Let's see. I gotta make sure I'm signing it in the right place here.
Yeah. That's basically an appointment by us, not a nomination, right?
Well, it says here nomination, so.
This form it's through Mass Department of Agriculture, and we just have to send it in every year. Just
Oh, and they
saying
do
that
the
she's still
appoint-
yeah.
Okay.
Do you know, Shelley, I remember Ann Espen had asked me, they were trying to do a new,
Yeah, that's being worked on right now.
so that
They-
hasn't,
Yeah, they're working on that now, and also, as far as the animal control duties, I think Littleton and Boxborough are in an intermunicipal agreement with her
let's see what else we
to
have
do
here.
that, so. That's the bill for the public hearing notice for the tobacco regs.
Where do you saw approval, okay, right there. And we have a 7:15 hearing. I'll be right with you, folks. For Bennett Orchards. And this was continued, I think you people continued it from the meeting you had earlier on. When was the earlier meeting?
Just one quick question to Shelley.
Sure.
Did 19 Dahlia come in to look at paperwork or anything like that?
She came in to pick up her permit.
Okay, that's it.
March 17th.
Yeah, I was sick. I was out spreading.
Peter Yap, not attending, ill, I wrote down.
Okay.
Contrary to, what do they say, the rumors about my early death were greatly exaggerated, or something of that nature.
You're back, you're back.
Yep, I'm back. So, where are we? Bring me up to date.
Well, there was going to be further discussion with the peer review engineer who was being considered for purposes of reviewing the nitrogen loading plan. And upon the further review, there was a determination that the review would not result in obtaining the type of information that would have been ultimately conclusive as regard to the concerns that were raised over the course of the last few months regarding nitrogen loading. And and as a consequence, we got a letter copy of the letter where the third-party peer reviewer was told that they're not going forward, and our client got his check back for the work.
Oh, good.
And I spoke with Jim Gariffi, and I think that Jim was going to send you an email or something today where he stands on this whole thing. I contacted town council, had town council double, triple check the nitrogen loading restriction easement instrument that I had prepared some time ago. And he got comments back regarding some changes he wanted made. They were really minor tweaks. And I made those changes on Monday and sent it back to him. So I think that we've come full circle in this whole discussion by this time, and we've concluded that where the plan meets the requirements of Title V, that the plan or a nitrogen loading restriction does not include any monitoring wells, that what we have is what is anticipated by the regulatory scheme, that perhaps if the water department wants to put some wells in, they'd put wells in as they might do anywhere in town as sort of an advanced warning system, sort of the, what have you been calling it, the
Canary in the
canary
coal
in the coal mine. But other than that, this project is no different than any other project in town where it has a certain number of bedrooms per acreage overall, and that's the purpose of the restriction. Ultimately, what we're looking for from the board is just to have you authorize a member of the board to sign the last page of the restriction, and it simply says, Littleton Board of Health hereby approves and accepts this grant of Title V nitrogen loading restriction and easement, the document that says that the open space in this project can never be used for any purposes that would generate any impact upon nitrogen loading, which makes perfect sense, since it's also pursuant to the planning board requirements, going to be subject to a conservation restriction, and the land will be used for nothing other than passive uses.
Open
like
space, like.
open space and bird watching and enjoying the environment.
Not agricultural?
The field will.
The
still.
field will,
Okay.
one of the smaller part may be, but we also eliminated language we had in there where you could conceivably use a low release fertilizer in the property. So, as Jim Gariffi reminded us, is that even a low release fertilizer would be prohibited in a nitrogen loading restriction area.
Makes
So we
sense.
took that out of the document as well
Makes
in the
sense.
last couple of days during town council's review and Jim's review.
Quick question, is town council all done reviewing? Somebody had mentioned that he still had some reviewing to do, or?
He
did I-
sent back 2 comments, and Jim had sent back some comments, and Jim looked at this today, and it looked like town council's comments had been addressed, and Jim just asked, he said he recommends the board approving it, subject to him just giving it a final once over to make sure everything was in there. So he said they can sign it, but he just didn't have a chance between Monday and today to read
Okay.
and make sure all the changes were in there. But he said the board can vote to approve it and sign it, but just give him that
Review.
chance to just make sure those 3 changes
Okay.
were in there.
Question, so the monitoring wells, kind of the agreement you had with the water department, that's no longer doing that?
Well, we'll talk to the water department about that. I mean,
We weren't involved in it all, I was just kind of
No,
curious.
my last comment to them was, let's see what comes from the Board of Health discussions, and then we'll get back to you.
Okay.
But there's no reference to monitoring wells in this instrument.
Now, Jim has put out a memo here, on his thoughts on it, and I was wondering if, Ann, do you want to read it? Save my
Sure.
voice.
I would be glad to.
Did you folks see this? Did
No.
you see it,
Okay.
copy?
Kelly's gonna make us.
Bennett Orchard. I would recommend the board approve the aggregation plan and include this memo with the approval. subject to a final revised copy of the nitrogen loading restriction and easement. The Littleton Board of Health has reviewed the nitrogen aggregation plan for the Bennett Orchard subdivision. The subdivision consists of 32 homes placed on a total of 45 acres. The site is located in the Zone 2 of the Littleton Water Department Whitcomb Ave wells, and as such, the site is considered nitrogen sensitive, requiring the development to meet the nitrogen loading requirements spelled out in Title V of the State Environmental Code. Limits the discharge of sewage to 440 gallons per day per 40,000 square feet of land. In accordance with Title V, this requirement can be met by providing building lots of at least 40,000 square feet per four-bedroom home, or providing 440 gallons per day per 40,000 square feet equivalency through the use of a plan. Smaller lots can be allowed if other land is restricted to achieve the 440 gallons per day per 40,000 square feet of lot area. The Bennett Orchard development achieves a compliance with the nitrogen loading requirements in Title V through the use of a plan. The proposed open space development utilizes smaller building lots and provides the appropriate amount of credit or restriction land to comply with Title V. The board's review of the plan finds that it was developed in accordance with the Department of Environmental Protection guidelines for Title V aggregation of flow and nitrogen loading and complies with Title V. The Littleton Water Department has expressed their concerns with the potential for the development to increase the nitrate levels in the Whitcomb Ave wells to levels that might require remediation, referring to the letter from the Littleton Electric Water White Department dated 1/7/15. The board appreciates the concerns expressed by the Water Department, but the site complies with Title V. The board is obliged to approve the plan. The Board of Health has no objections to the placement of monitoring wells in conjunction with the subdivision, though we feel the wells are of limited value because their locations are not established through the use of a hydrogeological study and are in close proximity of existing homes. The board would have concerns with any inferences made of their test results for the reasons stated above.
Okay. Any comments?
Nope.
Either
No.
from the board or?
Well known,
I
yeah,
think that's what the engineer said originally,
Yeah.
true.
so
I don't like to say I told you so, but sometimes it happens that way, so.
the engineers are
You're
usually
just
right.
lucky.
No, the engineers are
Once in a
usually
while.
right. I think
Yeah.
we were thrown a curveball with the wells and with
Yeah.
the inferences of what they wanted to do with the wells, so,
Yeah.
but yes.
Yeah, thanks, Ann, for reading that. I'd like to make mention, excuse me, that when we talked about Jim's comments, that Jim Gareffi, he's our health agent from Neshoba, and he looks over a lot of all the plans that actually involve in Littleton. So again, thanks for reading that over. So in this particular case, thank you, Gino, we have to vote on this to have it signed, or?
I think since we've voted all along to have different agencies review, we probably need to go back and vote to go forward with,
Well, it says, subject to a final revised copy of the nitrogen loading
that was a little tweak that
restrictive
was put in there.
easement.
I had given him the final copy, but
Yeah.
he said he wants more time to read it again. And we're fine with that, but his message to Shelley was to go ahead and approve it and.
Yes, so you can
but-
approve
But it
the,
won't get recorded or released or however you want to deal with it until he says he's read it again.
right, so you can approve the nitrogen aggregation
So we
plan,
just need a motion.
sign the last page of
Okay.
this.
Where is it?
And what he's referencing here is what you already changed, correct?
Right, correct, yeah.
Yeah.
Yes,
So I think we
This
should
is what
have
you
a
said
vote of
you
the
already
board to
changed.
authorize
Yeah,
you.
we're gonna-
No, he wants to,
reviewing it.
he wants to, I guess, read what I changed.
Right,
Yes,
but
yes.
you've already done this.
Yes.
I have,
Yeah.
I have made the changes.
Yeah.
Yeah.
Okay, do I have a motion?
I'll make a motion that we accept the nitrogen aggregation plan as submitted and approved by our health agent with the addition to the nitrogen loading restriction and easement changes.
And aren't you incorporating that memo in with your decision, with the vote? Isn't that what Jim asked you to do?
Yes.
Yes,
Incorporating that memo?
yes.
And
Yes,
that's part
this
of
is
your-
what I'm
it's part of
approving.
your voting, yeah.
Yes.
I second.
According to his documentation on his memo 414,
And authorizing me to sign.
and authorizing Peter Yap, the chair, to sign to approve.
Motion was made, I second.
You got a motion and a second to have myself sign for the Littleton Board of Health to accept the Title V nitrogen loading restriction and easement plan dated March 30th.
Yep, subject to the
And
final.
subject to a final revised copy of the same plan. All those in favor?
Aye.
Aye.
Okay, it's 4 ayes.
Wonderful.
Okay.
Bet Brad was there.
Thank you for your
too.
patience
Yes, moving.
during this process.
No, it all worked
Out
out.
of town?
No.
How do you want to proceed? The one I have there has the signatures of all of the Sandersons that are
Right.
collected around the country.
Yes.
So I can either leave
You
it
keep
with you
that.
in safekeeping, or you can keep it with the lawyer in safekeeping.
Yeah, just hold on to it until I
You want to
email
hold
you.
on to this?
No, give it
You
to
should
him,
get a
and he can
copy.
scan it to me tomorrow so that I have one with,
All right.
because I don't have the one with all the signatures on it.
And I won't do any, other than that, I won't do anything with it until I
Yeah,
hear
Jim
back
just
from you.
wanted to go back through that final version, because when he looked at it on his computer, he didn't have the redlined version, so
Oh,
I had it on mine, but he had to leave, so
all
I-
right. Wonderful.
it should be all
How
set
far
tomorrow.
along is this project?
Well, everything else has been done. The next step is to get the various septic permits approved.
And two of them have been held in abeyance, all submitted, revised, waiting for this.
This.
Obviously, he can't approve it, so. And I've got another 6 going in this week, and probably 8 or 10 the next week,
So you have to come back here
and
then.
we'll be done soon. Within the next 3 weeks, we'll have them all submitted.
Keep smiling, so far so good.
All right.
All right, good, thank you.
Thank you.
Thank you.
Take it easy.
Thank you.
So probably at this point, before we get into the tobacco regulations, we should sign the permits.
Okay, I have just 2 points.
Go ahead,
to-
Ann.
To bring up. You wanted to talk about you mentioned last week, you told me, or last time we met, you wanted me to mention training monies that we have available. Did you want to say anything about
Oh,
training
yeah.
monies?
What?
Okay.
Do you
Yeah,
wanna
let
spend
me,
a minute?
Let's put this aside a minute.
And then I have a comment about the medical marijuana regulation as I worked it through with town council last spring and last summer, continuing. I found, I was working with Chris Heap, and I found a conflict when I was reviewing and looking at the planning board medical marijuana reg. It was too late to put it on the warrant for last spring, because they were gonna vote on it. And then at the town meeting, this is in May, Tom and Chris said, let's not bring up anything with the correction, because people will confuse people, because why vote in through something that's gotta already be corrected? They said they'd put it on the fall warrant and discuss it with fall. I didn't see it on the fall, and then I brought it up again, but a little bit too late for the spring. So I would like your permission to remind Chris Heap and Tom to just get that change. It's a small change, but it conflicts with the state and it
But
conflicts
it
with ours.
won't get in with the May?
No, it's too late.
Yeah.
It's too late.
So it's
So
gonna have to
it's a
fall.
small change, but it just, I mean, why do we need to, there's no need to have a regulation that conflicts
Yeah.
with another board's
Yeah, you have
regulation
my permission.
over something. Okay, thank you. It's very
Yeah.
small, but it's an important change. And then you were going to talk about training?
Yes,
Or
the
did you wanna
training.
Say anything about that?
Well, I guess some issues came up on training when I was out sick. I'm not so sure. Was anything discussed on it at all?
No, Brad didn't want to talk about it
Okay.
until you came back,
got
but I
better.
did bring it up. I just said we need to use the
Well,
training. Is it-
the thing was that several years ago, or probably it was more like 3 years ago, I had talked with Bonnie. At that time, we were getting some new members in, and I felt that we would require a lot more training. And so we've built in How much was it, Shelley? What do we got, about $1,500 or something? About $1,500 that we haven't been using. I don't know what we ended up using last year. There used to be more training things from DEP than there seems to have been lately, but with some of our board members looking to get into some of the classes, I thought it was a good idea. I don't know what the other folks think here. We'll go into that in a little bit, because essentially, if we don't use it, it gets turned back in. And unfortunately, there is going to be a time where we are going to need the training money. I don't have a problem turning money back in, but I think if
It's good to use it.
it's good to use it, if we got somebody that's, wants to take a certain DEP course or training, I think that we should
Take
at least
advantage of it.
take advantage of it. That's correct. And I think in this case, I believe it was you, Ann, that wanted to take a course, and it was pretty expensive.
Yeah, kind of expensive. It's actually a certification, but what it would do is it would give me more in-depth in looking at plans, and also when I'm on site with Jim reviewing and looking at soil and septic inspections. But it's expensive, so I defer it to the board's decision on it, and I went ahead and paid for it myself. But I think things like that, I think, are valid, even if it's a certification. I think things to get the board more involved with what happens, with what we approve, with what we're supposed to be overseeing in terms of regulations, is a good thing. But I think, it's can be sensitive because the money is limited, and
Yeah.
I totally understand that.
Well, the thing is, judging from the past, we've had like 4 or 5 members on occasions go off to a DEP thing. And, the bill probably comes up to the same amount, except it's spread over 3 or 4 people.
Yep.
But if we're not using it at all, I don't see it as a problem. I don't know, Bill, you have any feelings on such?
Well, as far as soil analysis and things like that, that's why we have Jim Gareffi. I would be more than eager to participate in any webinars that are available. But going down to Cape Cod for a weekend, or going out to Springfield or someplace like that for a weekend, I just wish that there were more webinars that were available so that we could do them
The area.
at the convenience of being at home or at work, if that's available. But as far as a certification for something like that, the problem I have with that is somebody can come on the board and be on the board and get 3 or 4 different certifications for 3 or 4 different things and use it at their place of employment for an increase in salary when the town has paid the bill for it. I just think that a lot of what we do to learn more about what we do could or should be made available through webinars.
Well, part of my reasoning was, I was on it was a crematorium study
Yeah, we went there.
group. And we went off to Plymouth. We looked at crematoriums in Plymouth. We went to Mount Auburn Cemetery, looked at their facility. We went to Worcester. And not only did we use our own cars and never put in anything for them, we did it on our own.
We paid for it.
And that's what happens with a lot of board members. They're doing stuff on their own, continually, driving, not just coming to a meeting, but often all these other things. So I didn't quite, it's kind of like payback, if you will. I'm probably using the wrong term, but, it's, if something comes along and someone could utilize it, Yeah, they might get something out of it. I got something out of going to the crematorium study. I learned a lot about cremations and
Yeah.
stuff, but
We
we
did.
didn't. Yeah, were
I
you
was-
on that?
I was there with you,
Okay.
yeah.
Can I make a clarification statement?
Sure.
The certification that I was interested in is open to Board of Health members. So the state wants the Board of Health members to come to these and to see and learn. So it wasn't just open to people that are employed as health agents. This was open to Board of Health members and other qualified people.
If there is a need, I can go.
But I
will-
understand Bill's point too. I mean,
Yeah,
I
no,
think there are
Bill's-
people that work full-time that can't do the things that I can go do. I can go off for a couple days and go to a training and learn this and that, and I'm not limited because I don't have current employment during the day. And I understand what, your frustration that there are some things that are local, but they do take you out of the workplace.
Where were these courses being held, Ann? What- Is it in Worcester?
The soil evaluator, the 4 courses that are classroom are just over at the Acton Safety Building.
And how much
But they're not
is-
by webinar.
How much is that?
And then you have 4 different on-site, outside. It's a very expensive, it's about $950. It's a
But
very expensive
this
course.
isn't separate, they're all related, all, the
Yeah.
4 training days.
Right,
and
you do
going out,
4
okay.
classroom, and then you do 4 outside. So it's perfect just to learn about septic and to learn about what the engineers are looking at, and I'm happy to put the time and the money into it. I've paid for all my other certifications on my own. I do use the CEU availability through DEP and CBSP, which
It's
the
too bad
Board
it's
of
not.
Health will,
Mr.
which the
Chairman.
Board of Health has, the
Mr.
trainings that keep up my CEUs.
Mr. Chairman.
Yeah.
It's too bad there is only enough money just for 900, just for one individual. If there was enough money for 2 people, like I say, I will volunteer to go. And I'm not gonna use it to go and get a raise, Bill. At my age, I'm not,
Yeah, well, I don't get a raise
But I
either.
don't mind,
Well,
I don't
I'm
mind
not
doing
even
it because
employed.
we have to use that money, even though I don't really crazy about it, but if we can give something back to the board, I will mind learning a little bit more. And
Well, I think,
if it's local
prior
or
to
the
me
Cape,
coming down with that
it's too bad.
horrendous disease, I was gonna talk to Bonnie and the finance committee too.
Yeah,
to
we
see,
leave it up to you.
and because Bill raises a good
It's
point.
expensive, I understand.
And I'm not gonna vote on it tonight because Brad isn't here, but what I'm gonna do is talk to the finance committee. I'll get a little bit more information from you and,
That's fine, but as again, I've already submitted paperwork, I've already paid for it, but if the.
but
if
you
the-
could be
if-
reimbursed, it could be even a
Sure.
portion.
Sure, if the town wants to reimburse me, I think that's fair and fine, since I have given almost 10 years to the town in terms of program development, MRC, and Board of Health. That's, I think that's fine, but I also understand it's expensive, and I think things should be evenly distributed. I'd like to see more board members come out to some of the different trainings, but I
Oh, that's like what
understand,
Gina was just saying.
I understand
Yeah.
the logistical issues.
Can I make one comment?
Sure, go ahead, Bill.
My comment about the certifications wasn't so much, well, it wasn't at all directed at anybody. It was more about the fact that that's what Jim Gareffi
No, we know that.
does for us.
Yeah,
It's because I was specifically talking about the soils analyzation. But, if the money becomes available to go out and go to seminars and things like that, I wouldn't be against it. I wish that the state, the DEP, and anybody else involved with public health offered webinars, because I've taken webinars related to maintenance. And, they're very inexpensive. You can participate. And I just think it makes it much easier for somebody to do than it is to take a weekend and go down the Cape or somewhere else, that's all. That was my only point.
no, I understand.
No,
I think the
it's-
same
no, go
thing can
ahead,
be
Ann.
accomplished
Yeah.
through a webinar.
Go ahead,
Um,
Ann.
Well, I have almost all of Jim's certifications except the RS. So, and I did that long before I was involved with with this. So I'm ServSafe certified, I'm a certified health officer, I've gone through the housing. That's one thing that I did do with board money, is do the housing certification. But all the other certifications, I didn't know if you knew that, but I'm fully can inspect housing and restaurants and whatever. And I did it because when I got on this board, I thought, gee, this looks like a really interesting topic, interesting thing. I wanted to know what I would be over, but I'm like that. I don't mind getting my hands and feet wet and getting in there and doing things, but I basically have a lot of certifications. And I love it, I use it, it helps me understand things, but that's my approach, okay?
See, you brought up a good point, Ann. When I first came on the Board of Health, we organized a ServSafe class with Jim Gareffi,
Yeah.
I believe, taught it. He came down, we did it in conjunction with the Masons and several of the churches that did cooking, having like Saturday night dinners and stuff like that.
That's right.
And I forget how I think Jim did it for free, but for the course material, I think that the Board of Health paid for ours and the different organizations paid for theirs. But, it worked very well, and we haven't done any of that lately either, so. Well, it's something to think about. I can see that, I need to talk to Bonnie and look for some suggestions. Have you heard anything from Bonnie on anything of that other than?
No, not since that
Yeah.
first conversation I had with her.
Okay.
Yeah, and I want you to understand, Peter, I'm not expecting the town to pay for this. If it's okay with the board to go forward with it, I think fine,
Yeah.
but I'm not looking for that. I just asked to see if it was possible. So, it's
Well,
fine.
it may be even more palatable if they just put some money towards it or something, split the difference. I don't know how that would work, but.
Yeah.
But anyways, one of the things we do is sign permits, and I'm gonna do a couple right now and pass these out while we have a moment. Let's see, today is 4/14. Was just two,
There should be three.
should be three.
There is,
Spectacle
Peter, there's one
Pond,
underneath
Oh.
there.
Maplehurst, and Tehadawon.
Yep.
This is an old one, April 22nd, 2014.
Is that Maplehurst?
No, this is Spectacle Pond.
Oh, that one, the board signed that last year,
Gino
and
didn't
that was
sign
a raw piece of land, and
Gino.
now the new owner has purchased it and just is transferring the permit
Okay.
into his name.
Gino.
Let's see, I'll pass it down. Gino. Okay, that's the last of that thing. Here, Gino, you can put them in that permits to be signed thing. Correspondence, because I know
Wait a
we're
minute,
gonna,
this goes with the, wait. That's yours, right?
I do believe, 32514. Must have got mixed up in
There you
the,
go, there you go. Yeah, and I think there might have been a stickum that's missing too, because this one had a
Let's see,
paperclip
need-
attached to it. Does no
need a
fees
sign,
due.
there's nothing there. And I did these already. Pass these down, Gino, before I try to sign them again.
Okay, there we go.
Okay. We got a continued public hearing on tobacco regulations. When was it continued from?
The last meeting.
Which is?
Oh, wait, no, it was continued from before.
February 24th.
Yep.
February 24th. And the last I had heard, wasn't there some changes that lady was making? wanted to make, or
There were some changes she was making, and this is the draft she sent back, but with the email that I had forwarded this draft with, she was still asking DJ Wilson 2 questions about one of the definitions and something else, and I have not received anything more updated than this, so
how can we?
these are partially revised, but not fully revised from all the comments of the last meeting.
So do you know what one she's had the problem with? I remember seeing your email, but I forget exactly. So to get back to Ann again, because I know Ann did the bulk of the work on this. This is pretty much, you've looked this over, and this is pretty much everything we had talked about, and definitions, and so if we just wait for those last two or three suggestions that we can,
I'm not sure, has the board read through this regulation that was put out on 325? Has everyone gone through it and feel comfortable with it?
well, I wasn't sure what, this was based on, probably from the meeting we had from 224.
This is July
Well, this is
16th.
the corrections, and it got back
Yeah.
to us 325.
Yeah, that's what
I
I'm
guess.
saying, it looks like it's based
So-
on, from the meeting that we had on 224. Yeah, we might, just make sure that we haven't
I
seen
think there
some-
was still, Joan was still looking for clarification on one of the definitions, and if I remember correctly, it was one of the things that one was a nicotine and one was a non-nicotine, and Brad had asked for them to not be, not, for a non-nicotine to be listed under the nicotine items, and
It was a little
so
dicey.
she was still looking for some clarification on that, and I know I wasn't at that first meeting when Brad had the issue with, if I remember right, it was the vaping and the,
I have a problem with that, only because, correct me if I'm wrong, but the main reason for restricting the sale of tobacco is because of the addiction to nicotine. And that's why I have a problem with this going above and beyond that, where it says.
Where are you,
regard to
where are you,
electronic-
Bill?
I'm on page 3, total, or I'm sorry, tobacco product. Any product containing, made, or derived from tobacco or nicotine that is intended for human consumption. And then down below, it goes on to say that included but not limited to cigarettes, cigars, little cigars, chewing tobacco, pipe tobacco, snuff, or electronic cigarettes, electronic cigars, electronic pipes, electronic hookah, or other similar products, regardless of nicotine content. So,
So lumping them in with regular cigarettes and stuff,
right,
you know?
And that was based on our conversations over the past year and everyone's concern about e-cigarettes, the kind of chemicals and the different things that are in the vaping that aren't even related to cigarettes in general, just vaping. That we were concerned about that.
Well, they have,
well, is it because people are becoming addicted to it?
No, they have carcinogens in them. The vapors are not regulated, and there are carcinogens, known carcinogens in the vapors. That's why we're going.
but
So
the
let's lump it in
nicotine is a
together.
different nicotine than in tobacco, correct?
Yeah, there is.
Well,
Nicotine
they
in
sat
tobacco.
there and told us that they didn't know. Some e-cigarettes have nicotine in them. Most of them do have nicotine, that's the
But
whole
it's-
point of it.
But it's a different
but-
nicotine
but
than
in
what's
it-
in tobacco.
No, it's the same nicotine.
Well, I think
It's just the aerosols and vapor
Just the vapor
also have, in addition to the nicotine in the delivery system, they also have known carcinogens like formaldehyde and other things like that.
Which is not good for you anyway.
No, no, so that's the point, is that since it hasn't been regulated by FDA, we want to make sure that they're included in at least the age of 18 years old or older.
But this here is saying it's a tobacco product, and it isn't a tobacco product.
Well, we can say tobacco products and e-cigarettes regardless of the contents. I mean, that was the whole point of everyone's concern. And my concern, Brad's concern, other people's concern in general is it just seems like no one could give a straight answer. And in fact, when you look at the research, there are a lot of stuff in the vaporization and the aerosolization chemicals in these. So that's what makes it dicey here.
But in comparison though, and again, I could be wrong on this, but, reading what I've read, in comparison to cigarettes, the using the e-cigarettes and stuff, certainly way healthier, if there's such thing as healthier than smoking cigarettes.
No, now they're finding the chemicals in the vaporization are just as bad. There's 54 chemicals in secondhand smoke. There's more than that when you inhale a cigarette, and the e-cigarettes have a number of the same chemicals in the vaporization and
Probably even worse than
aerosolization.
nicotine.
Yeah, that's the part here, and I don't know exactly what Brad's concern was. I think I'm not sure exactly what it was, because everyone's concern was what's in the vaporization and aerosolization.
Yeah, it's still a little,
But I think the point is that it has a lot of the chemicals, and I think we've passed out a few articles as such over the past year, so.
I know, I think
I've-
Brad wanted the two definitions separate, if I recall.
I've
Trying to find
read
that note.
a couple of articles on the e-cigarettes and the vaporization, so on and so forth. And some professionals feel as though restricting that will encourage,
Regular
believe it or
smoking.
not, kids to smoke regular cigarettes. And that in fact, the e-cigarettes are a great way to keep kids from smoking cigarettes because they're not as harmful. My biggest problem is we have a sample regulation restricting the sale of tobacco products here, and that's what we're talking about. And I don't consider those other items tobacco products. And it really honestly bothers me that government, even on a small scale, starts out to try to regulate one thing, and then they say, well, while we're at it, why don't we do this?
pull the others in.
And that really bothers me. I mean, there are a ton of things out there that are not good for us. But at some point in time, people have to make up their own minds whether they want to take a chance or not, I guess. I don't know. I'm just really bothered by the fact that I think it's
Yeah, it almost should be.
Overstepping our bounds.
Well, it should be under something else, if you get regulations restricting the sale of tobacco products, and like you say, you add other stuff into it.
Well, that's the thing, is that the e-cigarettes do have nicotine in them. Sometimes they don't. How are you going to know if they do or if they don't? That's the hard part.
But all the stuff I've heard, but again, that the nicotine wasn't from tobacco, it's from something else. You didn't get nicotine in
It's
plants.
it's chemical nicotine. I
Yeah,
mean, they
yeah.
have it, but it doesn't matter whether it's tobacco or it's the nicotine
But
product,
I think what Bill
right?
is saying, these are called tobacco products.
Oh, I
You know,
see what you're saying.
yeah.
Yeah, probably it needs to be separated out. I don't know. But I've also read a lot of opinion articles that some people feel like, okay, great, you don't want to smoke anymore. Okay, well, that might protect your lungs from certain things. a lot of opinions in the Wall Street Journal from doctors writing in. But then you've got all the research data and the research articles that do talk about the hazards of the e-cigarettes, and then kids getting a hold of, the liquids and this and that. So, I mean, I think it's something where everyone just really needs to think about what is best and how can we most succinctly put this into this regulation. And I think, frankly, Joan Hamlet has done most of the work in complying this. I haven't complied this. I've just been a part of an advocate to help us understand the full gamut of the issues with the e-cigarette by providing opinion articles and research. So,
No, I'm
I
not
mean,
disagreeing with you, Ann. The thing is,
well, I'm not even saying an opinion. I'm just saying
yeah.
that's what I've tried to do. So I haven't really been a part of, other than the voting on the different pieces of it. But I think that when you have DJ Wilson, who is over a large of the tobacco work in the state, saying that because of the rules and regs, they're not required to put what's in the e-cigarettes. So it's up to individual research houses or different industry partners to go in and find out what is in them. So I think that's something that we can't really say yes or no, it does or does not have it in there, because some do and some don't. So I don't think we can fully say that e-cigarettes don't have nicotine in them. They do, but some don't. And how are you supposed to know the difference? I don't know.
Well, I think down the road, I think that in the future, the state and the Fed is probably gonna come up with
Well, the
rules
Fed-
and
it looks like the
regulations
Fed's gonna come up
totally
with something.
separate from cigarettes to cover
Yeah,
vaping and
yeah, maybe.
the e-cigarettes, because
It's a new thing.
I don't see them as that closely related. And I understand what you're saying, Ian, that there are chemicals in the e-cigarettes, but I can't help but think that somewhere along the line, somebody will come up with an e-cigarette that is not harmful, and if they do, and it keeps kids from smoking tobacco, I think that that's a good thing.
It doesn't have any.
I just hate to see those things lumped in with tobacco products, because by my own personal definition, I don't see how they can fall under that category.
Gina, did you want to add something?
Yeah, I'd like to say that unfortunately I don't smoke, so I can't be a person to give advice. But the question is, a young man, if they start smoking and they get hooked on it, it's a way of life for the kids. Now something else will come up and they say, well, try this. Today, children, whether they're 14, 18, they try anything is new. Before you know, they're going to try now. They're going to make it now legal marijuana, not only for medical, but they will be.
That's the next
It's
thing.
going to become legal to smoke it, like they do in Colorado. So we just can't control people. The question is, they have to, like she says, you have to make sure that they understand themselves what they're doing to themselves. If something is not good, they do something that is not healthy. You tell me if a cigarette, whether it's artificial smoke or whatever, it's healthy for anybody. The only healthy thing we have in life is a clear air to breathe inside and out. But people are addicted. And addiction is the worst thing you can have, whether they're drinking, drugging, or whatever. Any kind of addiction is the worst thing you can have. So people have to control themselves. You know, years ago they used to smoke a pipe or a cigar. Even women used to do that. Then the cigarette came along.
Cigarillos, I think they were.
So maybe this might say sale of tobacco delivery products, and that would cover everything from cigarettes to e-cigarettes with tobacco or whatever else
Right.
in them, you know?
We're trying to help others,
Sale of
but whether
tobacco delivery products,
it's a
I
business.
personally,
or
would-
nicotine delivery products. you
I
know,
personally
I don't know.
would like to stick with what it says, tobacco products. And then if you've got something else for vaping,
Maybe
know.
if someone wants to draft a vaping or whatever.
Yeah.
But
Yeah.
I do vote, I mean, I'm for keeping electronic cigarettes in with the tobacco product, because the whole point of the tobacco is the delivery of the nicotine, and e-cigarettes are a
It's
substitute
something new.
for that delivery of the nicotine. So I don't mind if we change the name of it, if that bothers people, or whatever, but I'm definitely for keeping the restriction, adding a restriction of, you know, e-cigarette.
So we're going to
Products.
continue this hearing to,
We'll continue.
Do we, when we, if, well, I don't know, I mean,
I
what
like to
does Bill
have
have
full
to say
board.
about that? And do we
Mr.
want to
Chairman,
just
I'd like
get
to have a
this
full
voted
board
in
before
and
we
then
make a decision.
change the vaping aspect of it later? Do we want to wait
Yeah,
and
that's-
see?
Can I-
What do we want to
like
do?
Gino has suggested, waiting to have a full board, then, and, I mean, we have regulations in place. It's not like we don't have any regulations out there. We already have regulations. And probably a lot of them are the same regulations that are in here, so, you know, I don't see it being a problem if we went and pushed it another 2 weeks.
Can I just throw one thing out there?
Go ahead.
Under tobacco products, I'd be happy with just eliminating, putting a period after "or other similar
What
products."
page you on?
Period, page 3, where it lists cigars,
Well, that's
little
kinda what Ann
cigars,
was
chewing
saying, too.
tobacco.
She wanted
Put a
to-
period there after "other similar products." And I would like to see, regardless of nicotine content that rely on vaporization or aerosolization, I would just like to see that taken out of there, that one half a sentence.
Where are you on that one?
Or other similar products.
Under tobacco
Right
products.
here, put
Yeah.
a.
You wanna
dot
eliminate
or,
that?
And then eliminate.
Just
Well, I think,
eliminate the statement regardless of nicotine content that rely on vaporization or aerosol.
and this is just
I
in the definition.
can't even say it.
yeah. This is just the definition.
Get rid of that and just go straight to tobacco product includes any component or part of a tobacco product. That's pretty much the only thing that really bothers me is regardless of nicotine, because I thought these rules and regulations were about the addiction to nicotine.
Okay, and then last summer, Brad, myself, a couple others were concerned about what is in the vaping and what's in aerolization. So this is just the definition sheet, Bill. So under tobacco product, that's the definition of it. We certainly could add another section here that defines vaporization or aerosolization or not. I mean, we could add that in. You know, see what I'm saying? Separate it out.
Well, what
And-
does
and then
that
add-
Jones say that writes these things up? Do they, has anybody else done it that way, that they've had a separate set of regulations, rules and regulations for the vaping type products and candy or any of that other stuff that,
I don't know.
maybe I could call her on that.
I don't know, and I think that's probably what Brad was concerned with too, is, do you remember, Shelley? Was that what he was concerned with as well?
Brad said in that definition is where Bill was just referring to regardless of nicotine content, he would like to separate nicotine, non-nicotine, so that the definition won't be undermined. You know,
Okay,
somebody
right.
questioning whether it's
Okay.
nicotine, non-nicotine. Then he says, is this definition solid, or should there be a separate definition? Get a clear answer.
Oh, okay, so that's basically kind of where we're going with that, is then underneath tobacco product, put vaporization or aerosolization in the definition. So he is concerned about the content of the vaping. I'm concerned about the content of the vaping from what I've read, but I don't know if you three are concerned about the content of the vaping.
Well, to be truthful, it's been
I mean-
such a long process, I think I've forgotten exactly some of the articles and what they've been saying, and
Well, I think part of the vaping problem is that people can put their own concoctions into it. So, and that's why I really think that down the road, there's going to be a whole separate set of rules and regulations to accommodate e-cigarettes and vaporization, because I just look at it as two entirely separate
Yeah.
things.
So this is like
an experiment, in other words, for everybody.
Pretty much.
Yeah, so when they find out and later on, they might make some corrections. Right
Yeah.
now,
Yeah.
I don't think anybody knows what's going on.
Yeah, I agree with Brad in that I think we should define things, pull that out, tease it out, pull it out, define it separately. I don't know.
Yeah, I kind
I don't know.
feel that way too.
I mean,
So let's give it,
define it.
let's push it down. I hate to keep kicking the can, but why don't we continue the hearing till a couple weeks, and Brad should be back by then too.
Is that yours? Oh, this is yours. I had somebody. Yeah.
Well,
understand.
someone want to make a motion to,
Want to adjourn.
no,
Uh,
not
uh,
to
you have to
adjourn.
continue the hearing
No,
first.
no, there's something else we gotta talk about.
Well, let's finish this one
Yeah,
first. We got-
finish it, but there's
Yeah.
couple other things that I wanna just
Someone want to
mention.
make a motion that we continue the hearing
I'll
till,
make a motion to continue the hearing for the next meeting, which will be 2 weeks from now.
Second.
which is the 28th?
28th.
Okay. What do you want to, anything else on that night?
There will be one coming in, so we'll just put this at
At 8
7.
o'clock?
Okay.
Yeah, okay.
Okay.
Maybe, Shelley, is there any way you could just ask Joan Hamlet to tease out that definition and get an answer? Because I think we asked her that a month ago.
Yeah.
That would be great.
So I have a motion. Did I hear a second?
Second. I made the motion.
You made the motion.
Yeah, there was a
I'll
second.
second it.
Second. I had a motion and a second to continue the hearing to 4/28 at 8 o'clock on the tobacco regulations. All those in favor, say aye.
Aye.
Yeah, that's a continuation of the public hearing, so it has to be.
Well, it's a continuation of this,
The public comment portion was closed.
Oh, okay.
So, but you just have to keep continuing it because
Yeah.
the hearing is still open.
you want to have to keep posting it either, so. Ian, you had something.
Yeah, I just wanted to jump back to the community septic loan program and find out, were we solid with the 5 initial applicants and their process in fulfilling their duties that they need to do to get accepted into this program? Are they doing well? I know you read off that some are, need their betterment agreement, some have partial pay, some are getting ready to submit, some are already ready to be signed. So they're, all 5 of them are going forward at a good rate, right? And,
Not a good rate, but they're
well, at
they're
a
going
rate.
forward.
It's going forward. Not as fast as we'd want, but, so my question is, we had made a list of about, I don't know, whatever it was, 10,
12, I think.
12. We ranked out the 12 in terms of need, in terms of proximity to our water supply, et cetera. When will we be ready to know if we have money to go forward to offer it to a few more people? I'm just wondering.
After the 5th one comes in,
Okay.
because they're not, some of them are higher, some of them are lower.
What are they running, about 25,000, 30,000?
Yeah. The first one was 26, the second one's 28.
So take 5.
The third one's pretty low, the third one's about 12 or 13.
Okay,
The fourth one will be the highest one.
so it almost,
that's got
it almost
certain-
looks like you can't
50.
get to 10, just by quick figuring in my head.
Well, we
Because it's
have 200,
200,000.
right?
It's 200,000.
Right, so we've got 20,
And
20,
if
28.
you're averaging them out,
13, and then about 50, right? That fourth one's expensive. Yeah, so we might be able to do a few more after 5.
I don't think you'll be able to do 10.
Yeah, but maybe a few more after
Yeah.
5.
Maybe.
Because, the reason why I ask is because 19, Dahlia,
But there's a lot of money.
is in
Over
need of
50,000.
some help. I think she was like number 6 or 7 or 8. She was one of the,
So
But
she
she's
put in,
known that, she's had a permit sitting in the drawer for over
No.
a year.
no, I know that. I know, but she knows that this is going on. So she
That's the one that's
she
in
wants
failure,
to.
right?
Yeah, she's applied. She wants to get into this if possible. So,
The first one's the hardest one, because it's each step, there seemed to be another step.
yeah, I know it.
So, I think once this first.
For the
commenced-
people that are trying to do it, they look at this like, oh, boy, this is a dragged-out
I
process.
mean, my guess would be the rate that these last ones have come through probably by the end of May. There'd be a pretty definitive number that I can give the board of what the total of those 5 was.
Okay.
That'd be
So
good.
at the end of May, we'll know more.
Who's the leader of the pack, Maplehurst?
Maplehurst equals a couple of, I don't know, because he did have it redesigned, so, I mean, it's not gonna be significantly different, but it should be lower than that
Yeah,
first.
maybe we can get to, maybe we can get to 6 or 7, maybe.
And that Dahlia one is already designed and already permitted, so it's,
See,
you know, she's got
Yeah.
pretty much, and she's already, you know,
Like Narcissus, that wouldn't be affecting Long Lake. The drainage for that goes over to Neshoba Brook.
Right, where this one does.
Where this one
It's-
does.
It's right, that one does, it's right there.
But the poor guy, he's had this thing on, he tried it on the last go-around to get funds to do his system, and then he ended up short. He was cut, you know, because he ran out of money before him.
his has been in failure for a long time.
Oh, it has, yeah.
A couple of them have been in failure. Dahlia, I don't believe, was failed when she applied, so that probably bumped her lower than it would have been if it had been failed.
Yeah,
Like,
it's,
you know, a little.
But that's designed and permitted already?
Mhm.
yeah, because
Why
we,
isn't she?
we authorized a second story to her, and as part of that, she had to get a system designed and get rolling with it.
Is that
See?
Ham?
See?
Halliday?
Yeah,
No.
yeah, okay, so that's what happened, but she needs some help with it financially, so that's what happened.
I don't think that.
Anyway,
Okay, anybody else have anything?
Nope.
With that, I'll entertain a motion to,
I make a
Adjourn.
motion to adjourn.
I'll
Second.
second.
I have a motion and a second to adjourn. All those in favor, say aye.
Aye.
Aye.